Good afternoon here in the UK, good morning in America, and good evening in the Philippines. And wherever you are in the world, hello and welcome to Effie Barker Human Interest. I am so thrilled today because joining us today is a veteran radio and print journalist who has exceptional talent in writing, Mr. Joel Bellman. Hello.
Good morning, Effie. Thanks for having me.
In regards to dealing with the pandemic, leaders are really being put in a very difficult position. Even Boris Johnson are being pulled in a different sides, the Tories and the Labour, and it's hard to be in that position. But in regards to Trump, I mean, what's your opinion?
Well, I think I agree with Vice President Biden, who has said repeatedly he would be guided by the science. He would listen to the experts, and listening to the experts means listening very closely and respectively and supportively to public health experts in epidemiology, because after all, pandemics and global plagues, the planet and the human population has experienced these over many centuries. And public health over the last 100 years, since the 1918 so-called Spanish flu pandemic, has really gotten a lot more sophisticated in terms of epidemiology, in terms of contact tracing, in terms of vaccine development. And our ability to understand what's going on with infections, even if we don't have cures or vaccines right away, but what it takes to minimize infections and use public health protocols and public safety protocols, those are well known. It's well known. There's no mystery about what works and what doesn't work and what kind of precautions should be taken. And Biden has said he would listen to those experts and follow that advice. And following the advice would also include following the advice of economic advisors and people that are responsible for administering public services and so on, and looking to them for creative ways to manage some kind of semblance of normal activity as much as is possible within the framework of public health protocols. And it's clear we could have done this very differently if they had responded right away with very aggressive testing and very aggressive contact tracing and quick and decisive shutdowns of businesses until the infection rates went down and they could get a grip on where the infections were occurring and how exactly they were occurring. We could have minimized the death toll, and we could have minimized the economic damage from the widespread shutdowns necessitated by the spread of infections much more widely than they needed to spread. So I think listening to the expert advice and putting it in place and addressing the supply chain issues seriously would have yielded much better results. But it's clear that between political imperatives of not wanting to spook the stock market, not wanting to damage his poll standing, his aversion to wearing a mask because he didn't think it looked manly or leaderly or whatever, caused a lot more problems. If he had just been more humble and graceful and prudent about accepting the expert advice and put it in place sooner, our problems would have been a lot less. There still would have been deaths, there still would have been infections, but far fewer. I mean, I remember the H1N1 pandemic, for instance, in 2009. I was working for LA County at the time. Our county public health department really swung into action with very clear and decisive leadership. They told the Board of Supervisors, which is the governing body of Los Angeles County, what they needed to do and what kind of resources they needed. And the board basically said, do what you need to do, tell us what you need, made it available, and they responded in a very effective way. And a lot of other public health departments responded in a very effective way. And as a result, we had something like, if I remember correctly, 14,000 deaths nationwide from that over the course of the entire pandemic. A vaccine was developed and made available because, fortunately, in that case, the strain was somewhat similar to other strains of H1N1 that had taken place. I went to some of the vaccine centers where they were administered. They had big tents set up and a very orderly way of checking people in and getting the vaccine out early. And that's how you achieve herd immunity. You don't achieve herd immunity by letting people get infected and just letting the epidemic rage through the population, and the people lucky enough to survive are then presumed to be immune for a period. You achieve herd immunity by vaccinating people so that they can develop the antibodies without getting sick, and then resist getting infected if they happen to be infected later after they've been vaccinated. That's what herd immunity that's where it can really work.
What I've seen really with Boris Johnson, you could see it in his face. He's really struggled sometimes during the press conference. He really struggled answering questions. Do you think by any chance Trump struggled in his decision?
I think he probably has struggled, but the struggle has not been between. It's not so much been between competing objectives of wanting to protect the economy and protect people's livelihoods on the one hand, and protect people's public safety and health on the other hand. That is a difficult straddle. Governors like Gavin Newsom in California, Andrew Cuomo in New York, Gretchen Whitmer in Michigan, and other places are struggling with this. And there are somewhat competing objectives there. But the problem with President Trump, I think, is that he did not want to listen to advice. He is so psychologically insecure that he's actually threatened by smart, intelligent, qualified advisors and experts who might know or do know more than he does about a specific topic. We've heard him repeat over and over and over, I know more about ISIS than the generals. I know more about epidemiology than our scientists. You know, these people are idiots, those people are idiots. He always has to present this idea that he knows more than the experts, and he's a better judge, and he's been more successful. And if you've got that kind of insecurity, that you've always got to put down the experts and elevate your own level of expertise, even when it isn't there, you are going to be resisting all the good advice that you're getting from whatever side it's coming from whether it's from your economic advisors. Even somebody like Peter Navarro, his trade advisor, famously wrote him a memo in January and said, basically, Mr. President, this has the potential of being very, very serious. And it was ignored. Anthony Fauci and other epidemiologists, Robert Redfield, the director of the CDC, their advice was ignored. And not just ignored, but treated with contempt and disrespect and mocked and ridiculed openly and publicly. And the public hears that, and it hurts the credibility of these individuals, and it hurts the credibility of these institutions. And when the president is proven wrong in his assertions, people are confused and frightened, and they don't know who to believe. He's discredited the experts, he's discredited himself, and people, you know, at some point, some people may think, to hell with it. You know, why should I listen to the experts? They're always wrong. They were wrong. You know, initially we were told that we didn't need to wear masks if we observed social distancing and lots of hand washing, because the public health community was worried about a shortage of masks. We didn't have enough masks for our frontline health workers. Then they realized after a few weeks that even cloth masks like bandanas could work to minimize the spread of possible virus. The mask wouldn't protect people from other people so much as it would protect other people from somebody wearing a mask who might unknowingly be infected. And they realized that if everybody wears a mask, whether or not they're infected without even knowing their status, there is just much less of a chance of spreading those respiratory droplets, whether or not you're infected. And the less spread like that, the less potential there is for those infected to infect others. So even a cloth mask would work. And at that point, early April, the advice changed. And the advice now for more than 6 months has been wear a mask. And it's been proven to be effective. And yet the president still minimizes the effectiveness, continues to invoke the fact that the advice was right at the very beginning, you don't need to wear a mask. He continues to have events where people are not wearing masks. And even now, this deep into the pandemic, he sends either mixed or negative messages about something as basic and inexpensive as wearing a mask.